Welcome, and thank you for viewing a presentation on Form CMS 1500 and the expanded provider law, specifically how they relate to billing for providers. The main focus of today's webinar is to answer some of the most frequently asked questions we've received from providers regarding both initiatives. Resources will be provided at the end for additional questions. Today's presentation will start with a brief overview of the Centers for Medicare and Medicaid Services, Form CMS 1500. As Form CMS 1500 is already familiar to virtually all medical providers and insurance carriers, the Board anticipates a relatively smooth transition to Form CMS 1500. The initiative will leverage providers' current medical billing software and medical records while promoting a more efficient workers' compensation system. After the overview, we'll then take a look at the top questions we receive about Form CMS 1500. Next will be an overview of the expanded provider law and what providers need to know. Please note, this presentation will provide information and answer questions regarding the billing and technical side of Form CMS 1500. If you have practice or clinical related questions that are medical in nature, you'll be provided with resources at the end of the presentation. Before we dive in, let's take a moment to talk about the why behind these two initiatives. The Form CMS 1500 and expanded provider initiatives are part of a larger effort to increase injured workers' access to high-quality health care. Both are aimed at getting more healthcare providers to participate in the workers' compensation system. Having more providers who treat injured workers in New York State gives injured workers more and better options for getting the care they need so they can recover and return to work. Now let's take a closer look at each initiative and some recent frequently asked questions. We'll start with our transition to the Universal Billing Form, CMS 1500. Providers have previously indicated that the unique paperwork requirements currently in the New York State workers' compensation system are time-consuming and cumbersome to complete. To reduce the administrative burden on providers and encourage participation, the Board made the strategic decision to consolidate and eliminate certain medical billing forms and transition to using Form CMS 1500. Healthcare providers are very familiar with this form as they already use it to bill the Centers for Medicare and Medicaid Services as well as health insurers. Moving to Form CMS 1500 will remove a barrier for healthcare providers to participate in the workers' comp system and ultimately give injured workers more options for treatment. Now let's answer some of the most frequently asked questions from providers about the Board's transition to Form CMS 1500. Question 1. How will Form CMS 1500 be phased in? Form CMS 1500 will be rolled out in 3 phases. Phase 1 is voluntary submission, which is the phase we're currently in. During this phase, providers may transmit Form CMS 1500 medical bills and required medical narratives and/or attachments as applicable through their XML submission partners, most commonly known as clearinghouses, to many workers' compensation payers, which includes insurers, third-party administrators, or self-insured employers. To participate in the initiative, providers must register with the Board to submit Form CMS 1500 via an XML format. The XML Forms Submission Project was created to set up a method to allow the submission of data to payers and the Workers' Compensation Board in an industry-standard format. Clearinghouse status can be found by visiting wcb.ny.gov and typing List of XML Submission Partners into the search box located at the top left-hand side of the page. Phase 2 includes mandatory payer acceptance of electronic billing, electronic explanations of benefits and explanations of review, and simultaneous legal and valuation objections. Starting October 1, 2021, payers must electronically accept Form CMS 1500. This can be EDI or other agreed-upon electronic format. Workers' compensation payers will accept Form CMS 1500 medical billing files from XML submission partners and electronically return acknowledgments of receipt of these bills to the XML submission partners, who will share the acknowledgment with providers. The XML submission partner will also transmit the accepted medical bill to the board on behalf of the provider. Also effective October 1, 2021, payers must simultaneously file any legal or valuation objections they may have regarding payment of the submitted medical bill. All objections to payment must be made within 45 days of receipt of the medical bill. If the medical bill was submitted to the payer electronically, the payer must also return the EOB electronically. Phase 3 includes mandatory provider submission of Form CMS-1500 and Standard Claims Adjustment Reason Codes, CARCs, on explanations of benefits and explanations of review. Providers will be required to submit Form CMS-1500 medical bills and required medical narratives as applicable. We highly recommend that they be sent in an electronic format, which can be EDI or other agreed-upon format, through their XML submission partner to workers' compensation payers. Payers will be required to use a standard set of Claim Adjustment Reason Codes, CARCs, on the EOBs and EORs to object to payment of medical bills. And there will be new versions of Form C-8.1b and Form C-8.4 that contain these same CARCs. The board has mapped the current objection reasons to the CARCs used in the X12-835 EDI standard. These can be found by visiting wcb.ny.gov and searching for CARC codes. Question 2. Can providers use and submit Form CMS-1500 now? Yes, providers may currently submit Form CMS-1500 via mail, email, web upload, and XML. However, it is recommended that it is done electronically through one of the approved XML submission partners. The board strongly encourages providers to switch to using Form CMS-1500 now in order to become familiar with it prior to the mandatory July 22 implementation date. Question 3. Where can I find instructions on how to fill out Form CMS-1500? There are a number of resources on the board's website regarding Form CMS-1500. PDF examples of the form by provider type can be found by visiting wcb.ny.gov and searching CMS-1500 examples. On that same page, there are also several sample forms showing how information from several reports transfer to Form CMS-1500, including the doctor's initial report, doctor's progress report, ancillary medical report, attending ophthalmologist's report, doctor's narrative report, psychologist's report, and the occupational/physical therapist's report. Question 4. Where is the treating provider's information entered? The authorized provider who rendered the services should include their national provider identifier in field 24J of Form CMS-1500, and they are required to electronically sign Form CMS-1500 in field 31. Additionally, their Workers' Compensation Board authorization number should be found in field 19 along with their rating code. Note: the treating provider should electronically sign the bill, even if it is one of the newer provider types authorized through the expanded provider law, which we'll discuss shortly. Question 5. Can all providers submit Form CMS-1500? All board-authorized providers are able to submit Form CMS-1500. A new law, the Expanded Provider Law, was recently passed expanding the types of medical providers that can be authorized to treat injured workers in the New York State Workers' Compensation System. Prior to this law taking effect, only physicians, chiropractors, podiatrists, and psychologists were able to be authorized to treat injured workers. As of January 1, 2020, licensed clinical social workers, nurse practitioners, and acupuncturists, as well as physician assistants, occupational therapists, and physical therapists may apply to become board-authorized providers. We'll share more on the expanded provider law a little later in the presentation. Question 6. What other forms can I use now? All medical providers are encouraged to use Form CMS-1500 with an attached medical narrative report. But the current forms may continue to be used until the submission of Form CMS-1500 becomes mandatory in July 2022. Visit wcb.ny.gov and select Get WCB Notifications on the bottom of the homepage to sign up. You can view this chart by visiting wcb.ny.gov and searching Board Forms by provider type. Question 7. Where can I find specialty and rating classification codes for treating providers? Physician and non-physician specialty and rating classification codes can be found by visiting wcb.ny.gov and searching Rating Classification Codes. As previously noted, the treating provider's rating code should be found in field 19 of Form CMS-1500. Question 8. Will the required timeframes for submitting the medical reports change as a result of this initiative? The timeframes for submitting medical reports to the board and the payer are set forth in New York Codes, Rules, and Regulations, Section 325-1.3, and they are not changing as a result of this initiative. The following timeframes are still required. Initial Form CMS-1500, formerly Form C4, Form OT/PT4, or Form PS4, should be submitted within 48 hours of first treatment. Subsequent Form CMS-1500, formerly Form C4.2, Form OT/PT4, or Form PS4, should be submitted 15 days after first treatment and thereafter for continuing treatment after each follow-up visit scheduled when medically necessary, but not more than 90 days apart. As you may know, the Board amended Regulation Section 325-1.25 effective January 1, 2020. This change simplifies the billing dispute process by eliminating the continuous course of treatment concept, and it extends the time frame for bill submission to 120 days after treatment. Question 9. Do all Form CMS-1500 submissions require a narrative or attachment? Yes. All Form CMS-1500 submissions, whether submitted through an XML submission partner or sent directly to the board, require a medical narrative and/or attachment. The board has developed a medical narrative report template that can be used to create the medical narrative report that accompanies providers' submissions of Form CMS-1500. A PDF of a medical narrative report template can be found by visiting wcb.ny.gov and searching for Medical Report Template. Question 10. Is the doctor's report of MMI/permanent impairment, Form C4.3, being replaced with Form CMS-1500? No, Form C4.3 will not be replaced when Form CMS-1500 becomes mandatory. Question 11. Will the board require a standard set of codes for payers to use when objecting to a bill? Yes. The board has published a standard set of Claims Adjustment Reason Codes, also known as CARC codes. It's expected that these codes will be required to be used on explanation of benefits sent to the provider effective July 1, 2022, if a payer objects to a medical bill. There is one set of codes that all payers must use, instead of each payer having their own codes. So this should make it easier for providers to know why a submitted medical bill was not paid in full. Now that we've walked through the most frequently asked questions we've received from providers on Form CMS-1500, let's look at another initiative, the Expanded Provider Law, and what you, as providers, need to know. The Expanded Provider Law went into effect in New York State as of January 1, 2020. This law expanded the types of medical providers that can be authorized to treat injured workers in the New York State Workers' Compensation System. As of January 1, 2020, licensed clinical social workers, acupuncturists, nurse practitioners, physician assistants, occupational therapists, and physical therapists may apply to become board-authorized providers. This change has already brought thousands of newly authorized providers into the workers' compensation system, and it's expected that number will continue to grow, dramatically improving injured workers' access to health care. If you are not already board authorized, you should become board authorized as soon as possible. Effective January 1, 2020, All providers who can be authorized by the New York State Workers' Compensation Board to treat injured workers must be board authorized to continue treating injured workers. Ancillary providers who currently treat must become authorized or have an authorization application pending with the board to continue treating after January 1, 2020. Here are some of the top questions we've received from providers in regards to the expanded provider law. Question 1. Who can do what? Under the expanded provider law, certain types of medical providers can be authorized for certain services. Let's take a look at what each profession can and cannot do in the workers' compensation system. Board-authorized acupuncturists are able to treat workers' compensation patients, but will require a referral from the treating healthcare provider. Board-authorized acupuncturists do not have the ability to perform independent medical examinations, which are consultations performed to help resolve disputes in workers' compensation cases, usually at the request of the insurer. Board-authorized licensed clinical social workers are able to diagnose and treat clients who have work-related injuries or conditions, provide opinions on causal relationship, whether the injury or illness is causally related to work, make determinations for a client's initial and ongoing level of disability, and provide opinions on permanency, the degree to which a client's disability is permanent. Board-authorized licensed clinical social workers do not have the ability to perform IMEs. Board-authorized nurse practitioners are able to diagnose and treat clients who have work-related injuries or conditions and provide opinions on causal relationship, again, whether injury or illness is causally related to work, make determinations for a client's initial and ongoing level of disability, and provide opinions on permanency, the degree to which a client's disability is permanent. Board-authorized nurse practitioners do not have the ability to perform IMEs. Board-authorized physician assistants are able to treat workers' compensation patients under the treating provider's supervision and determine a patient's ongoing level of disability. Board-authorized physician assistants do not have the ability to perform IMEs. Board-authorized physical therapists will be able to treat workers' compensation patients, but will require a referral from the treating medical provider. Also, while physical therapists are currently able to treat injured workers, those who are employed by a medical practice, as well as those who are self-employed, may now obtain their own authorization. This means they will be listed under their own name in our registry of authorized providers. Board-authorized physical therapists do not have the ability to perform IMEs. Board-authorized occupational therapists will be able to treat workers' compensation patients, but will require a referral from the treating medical provider. Also, while occupational therapists, too, are currently able to treat injured workers, those who are employed by a medical practice, as well as those who are self-employed, may now also obtain their own authorization. This means they will be listed under their own name in our registry of authorized providers. Board-authorized occupational therapists do not have the ability to perform IMEs. All of the information just shared is also available in chart form on the board's website at wcb.ny.gov/new provider. Select Changes for Authorized Providers, Who Can Do What chart in the Related Resources section. In addition to the new provider types, the chart also covers what physicians, chiropractors, podiatrists, and psychologists can be authorized to do. Question 2. How do I become authorized to treat injured workers or to perform independent medical exams? To apply for authorization, you must sign up to use the New York State Workers' Compensation Board Medical Portal and/or log in with the credentials that have been assigned to you. Complete the required training specific to your profession, and complete the new provider authorization request online application. As a reminder, only physicians, chiropractors, psychologists, and podiatrists may enroll to perform IMEs. Question 3. How often do I have to renew my authorization? Your authorization runs concurrent with your state license. Whenever you need to renew your state license, you should also renew your authorization. When your license expires, you'll receive an email from the board with instructions on how to renew your authorization. This renewal will all be done online via the board's medical portal. Question 4. How can I check authorization status? The board has an online search of all healthcare providers and independent medical examiners who are authorized with the Workers' Compensation Board. Visit wcb.ny.gov/healthcareprovidersearch. Scroll to the bottom of the page. You can search for either healthcare providers or IMEs. For a full list, use the Find All tab and view and download the results in Excel. To inquire about provider application status, email provider@wcb.ny.gov. You can also stay informed of changes to the authorized provider list by subscribing for WCB updates. Visit wcb.ny.gov and select Get WCB Notifications on the bottom of the homepage. Question 5. Which medical fee schedule should I be using? This table details the medical fee schedule each new provider type must use. It's important to note, while there were some revisions to the New York State Workers' Compensation Board medical fee schedule effective January 1, 2020, there were no CPT coding changes made. With the exception of the New York State Workers' Compensation Acupuncture and Physical and Occupational Therapy fee schedule, which must be purchased from Optum 360, all other revisions to the fee schedule are available as free downloads from Optum 360. Please note that per Acupuncture Ground Rule 7, an acupuncturist may only use CPT codes contained in the acupuncture fee schedule for billing and treatment. A licensed acupuncturist may not use codes that do not appear in the acupuncture fee schedule. For more information on medical fee schedules, visit wcb.ny.gov and type in Medical Fee Schedules into the search box in the top left-hand corner. Question 6. What other providers or medical suppliers can perform services? The following provider types and entities can also provide services and submit HP1s for unpaid bills: ambulance services, ambulatory surgery centers, audiologists, dentists, durable medical equipment vendors, hospitals, laboratories, optometrists, out-of-state providers, and pharmacies. Question 7. What if my bill isn't paid? Providers authorized by the board will be able to use the Request for Decision on Unpaid Medical Bills Form HP1 process if their bill is disputed or not paid. Form HP1 must be submitted under the provider name and authorization number. It cannot be submitted using the practice name. Billing information and training is available on the board's website under Healthcare Information. We want to remind you of the new business information system the board is building called Onboard, which will replace our multiple paper-based claims systems, such as eCase, with a single web-based platform. With a focus on improving the entire workers' compensation experience for injured workers, the new system will offer exciting elements, including real-time claim data, new electronic self-service features for interacting with the board, easy accessibility, allowing you to verify the receipt of documentation, understand the status of your claim, check on pending documentation requests, and a reduction in the amount of overall paper forms to improve system responsiveness to all your needs. To stay informed as more information is available, keep an eye on our website at wcb.ny.gov/onboard. There are a number of additional resources available to you on the Form CMS-1500 and Expanded Provider Law initiatives. For more information on the Form CMS-1500 initiative, you can visit wcb.ny.gov/CMS-1500 and email cms1500@wcb.ny.gov. For more information on the Expanded Provider Law, you can visit wcb.ny.gov/newprovider and email provider@wcb.ny.gov. To stay informed on these and other initiatives designed to make the board better for workers and better for business, you can subscribe to get board notifications straight to your inbox at wcb.ny.gov/notify. You can also visit wcb.ny.gov and select Get Notifications on the bottom of the homepage. You choose the topics you'd like to subscribe to. You can also follow the board on Twitter, YouTube, Facebook, and Instagram for board news, project updates, training, and more. Thank you for watching this presentation on the Form CMS-1500 and the Expanded Provider Law, specifically how they relate to billing for providers. Please contact us if you have any questions on these or other New York State Workers' Compensation Board initiatives. Thank you.